We're going to wrap this section up by talking about nutritional research and nutritional assessments. At least give a quick overview of those. When we're talking about how we study nutrition, we're looking at what the nutrients in foods are and how we're going to use those nutrients for physiological functions. There will be various types of studies that will answer questions about nutrition, and we generally use scientific protocols for conducting research in every medical and health discipline, including nutrition. So you will come up with a hypothesis and you will develop a theory or theories around that hypothesis, and then you will use the following types of studies or trials to determine if you are correct. And not all scientific studies are created equal. They are not. So epidemiological studies are going to take a look at the risk of illness or death, yikes, in one population and compared to an identical unexposed population. In lab studies, you are doing work within a lab to discover if a drug or a procedure or a treatment or a nutrient is useful. And when you talk about clinical trials, generally the gold standard for that are random double-blind studies. This shows you the steps to scientific method. And here's hoping that your hypothesis is correct and your tested hypothesis come out well. So who actually regulates nutrition? And that's kind of a crazy mismatch and mismatch of various governmental agencies. So over the course of decades, researchers have published sort of energy and nutrient standards, and every once in a while, those are periodically updated as new information becomes available. And one of the problems about trying to determine who, in air quotes, controls the nutritional standards is that many governmental departments has a role in regulating and developing sound nutritional standards here in the US. Federal gov, state governments, USDA, FDA, it's kind of crazy making. When you talk about nutritional assessments, it is kind of like a game of nutritional clue, because you have to take a look at various aspects of your patient. So ideally, it would be done by someone who has training. It doesn't have to be a trained clinical nutritionist, it should, or a registered dietitian. It should be someone with sufficient amounts of training and who has a license. So that's the type of ways that you can diagnose various problems. And let's talk a little bit about nutritional assessment when it comes to both malnutrition and deficiency conditions. Actually, this is pretty interesting, because issues that arise because of malnutrition and in nutritional deficiencies can be diagnosed before they actually cause visible signs and symptoms. So if you don't get enough of a specific nutrient, or have insufficient energy consumption, or you consume more than necessary, you can actually be malnourished. And you can be malnourished and obese at the same time. Yes, you can, because if you are eating too much of one type of food and not enough of the appropriate foods, you can be deficient. So malnutrition is sort of defined as any condition that's going to be caused by an excess or deficient energy or nutrients. And you can have a deficiency of both energy and or nutrients, or an excess of energy or nutrients, as I mentioned before. These are the signs of malnutrition. And you should know those, not only for the assessment, but in general, especially if you're going into healthcare. And sometimes symptoms can be overlooked because they sort of resemble symptoms of other conditions and dysfunctions. You know, you have a skin rash. Is it a skin rash because of a deficiency, or you have some sort of allergy to something? You're in pain, you have joint pain, you have muscle pain. Well, is it because you just ran a marathon, or is it because you're deficient in something? And same with diarrhea. What is actually causing that? So malnutrition issues can be diagnosed and treated when you are actually using nutritional assessment techniques. If you have a primary deficiency, it is due to inadequate dietary intake of a nutrient. You're not eating enough of it. Secondary deficiency can be triggered by something like medication. So when you have a secondary deficiency, it's caused by something other than insufficient consumption. You have a disease that reduces nutrient absorption. Cancer is a classic example of that. Or for some reason, you're excreting more of that nutrient than you should be. Or something happens and the nutrient can't be absorbed, or the nutrient gets damaged. Sometimes you have overt clinical symptoms, and sometimes you have covert clinical symptoms. If you have a subclinical deficiency, that's generally in the very early stages of a deficiency before you have any outward signs. And yes, you can use lab tests to help diagnose those. So we know this, but let's say it again. You're going to hear this multiple times throughout the course. What you consume plays an important role in your health and well-being. Early on in nutritional research, you found that researchers were looking at nutrients that would prevent deficiency diseases. Now, most of our nutritional research is going to be looking at diseases that are linked with energy and nutrient excesses, because we have such a problem with obesity in this country. In the next module, we get to talk about our anatomy, and we talk a little bit about physiology of digestion. So more as it happens.